her doctor's office called us because she didn't know where she was at.
With this disease, you're watching a person erode away.
Alzheimer's disease incurs more costs than cancer and heart disease.
My husband, Richard, was starting to have Sundowners. Their whole personality changes.
My mother is more depressed than usual. She has hallucinations some nights.
These associated neuropsychiatric symptoms like depression and anxiety, they really can cause a lot of pain and suffering.
I want to give my mom as much as she gave me, which was everything. Being her son and the closest with her, I noticed there were a couple small things.
I noticed big changes were happening when her doctor's office called us because she didn't know where she was at or how to get home.
None of the roads looked familiar. She didn't know how to operate the GPS on the car, and she didn't know what to do.
And me and my husband had to locate her and get her back home. That's when we knew for a fact, okay, something big is happening.
That was a very scary situation for me.
I quit driving quite a while ago
What made you decide that you wanted to stop driving?
because I knew common sense tells me you can't drive. You can't do this anymore. You could fight, but it's not going to get you anywhere.
Right now, my mom is what is referred to as a transitional period. That is the stages in the disease where she is transitioning from being fully independent to not as independent as a normal person. So her cognitive disabilities are inhibiting her to the point where her day-to-day processes are not functioning correctly.
Initially, we saw something was going on after she did a year of chemo for her leukemia. At first, we thought it was chemo brain. And as time progressed, there was no change. And that's where, at least for me, I started to kind of internally think, this isn't chemo brain anymore. This is something else.
There was no particular activity I did. I just knew I wasn't right. I knew that. A person my age would know that. Oh, emotionally, it's unbelievable. It's just very, very difficult because you don't know what you're doing a bunch of times. It's terrible.
When you're dealing with this disease, you're watching a person erode away in front of you. You're watching a person lose who they are, their personality. So you just enjoy what you got and you make the most of it.
My name is Karen, and I've been diagnosed with Alzheimer's disease.
Alzheimer's disease is a disease of the brain in which there is slow but steady progressive decline in cognitive abilities and eventually also affect behavior, mood, and our daily functions. Any condition that damages the brain and leads to enduring cognitive impairment is what we call dementia, with the most common form, especially later in life, being Alzheimer's disease.
If one goes to their family healthcare provider and they're doing an evaluation and they give you a diagnosis of dementia, it's a good idea to ask, what type of dementia do you think that I have?
The changes someone is experiencing might not be Alzheimer's disease. So there might be reversible factors that you can intervene and stop or even reverse the cognitive changes someone has. So they can be made worse by depression, by medications, by medical issues. If we can attend to those, we can make a big difference. Probably close to 90% of individuals at one point or another are going to have difficulty with things like depression or anxiety, with behavioral changes, sometimes agitation. Treating these associated neuropsychiatric symptoms. It's so important. These are very common. They can be very, very debilitating for people. They can rob them of purpose and of a good quality of life. And they really can cause a lot of pain and suffering. Alzheimer's disease incurs more costs than cancer and heart disease. It's actually the single most expensive disease in our country right now, and it's at epidemic proportions. We're approaching 7 million Americans who have Alzheimer's disease, and probably double that number who may be in early stages of Alzheimer's or other forms of neurocognitive impairment, and those numbers are going to double in the next 25 years.
That's his pride and joy.
So, yeah, she gets upset, worried. She gets worried a lot.
Pride and joy.
And then for my husband, I mean, no one wants to watch their parents worry and not be able to fix it. And I appreciate that she likes me so much as a daughter-in-law and finds me helpful.
When she came to us, there was already, according to the family, irritability. She was already getting frustrated sometimes with doing basic things. Sometimes we may see depression. Sometimes we may see psychotic symptoms, even visual hallucinations. The middle stage is a long stage because that's when we need to think about giving them more assistance, more supervision, more help.
One of the things that worries me the most about my mom living by herself now that she has Alzheimer's is that she's going to injure herself. I'm worried that she's going to get frustrated, that she's going to have some kind of event and not be able to function, not feed herself, not be able to care for herself. You know, I don't want that for my mom.
Her personality was extrovert, and I think that's putting it lightly.
Hey!
She was social, makes friends wherever she goes.
You look good.
Girl?
Her personality now is very reserved. It's very reclusive. Just anything from not answering the phone to just not really wanting to participate in things. So she relies a lot on others now to take her out and do things.
One of the things about Karen is that throughout the course of Alzheimer's disease, there can be, for one, personality change or accentuation of premorbid personality.
And what we often miss is what's called apathy, so just a lack of motivation.
She watches Hallmark all day. She walks the dog. That is a very isolative life. And for people who have a cognitive disorder, it's very vital that they have some type of stimulation constantly.
Winston is very important. He goes everywhere I go.
Good boy.
He barks a lot. And he's just my best friend.
So I'm an only child. My dad has passed away. I am the last one left for my mom. She has nobody, in the family to really rely on. So for me, it's my duty. It's my obligation. It is the task that has been chosen for me to do.
I can't even, imagine being an only child and your last parent, what he's going through. Sorry. He's the person who'll take it all on, and I love him for that.
If you don't have a positive attitude, you're lost. Well, with the help of my kids, I don't have anything that I can't do. I've got 2 really good kids. The
family member is always what I call the second patient. they're at risk for depression, they're at risk for burning out. This disease has great impact on the patient, but sometimes even more so on the family members.
My name is Anne, and my husband Richard has been diagnosed with Alzheimer's disease. We've been married 37 years, and they've all been absolutely wonderful because we have been able to travel and pursue my art and his interests, which is art collecting and just living in the Keys and having a boat and enjoying life. Richard is still very cerebral. He uses all of his faculties very well except memory. His memory has left his body. I try now, as his wife, to be present with him so that we can have the highest quality and the fullest life together. We go to theater, we go to a repertory group, and we watch movies. He follows them. So, I mean, he's still in there. And I really make sure that we live our life to the fullest with what we have, not thinking about what we don't have. He's not an independent person now by any means. He doesn't know his address. If he gets lost, he doesn't know where he is, what to say. I mean, he would just get picked up like a vagrant, and I'd probably have to go somewhere to find him. If the police picked him up, it's pretty frightening. So I have to make sure he doesn't wander around on his own. It was the first year we were spending in Key West, and usually we go back in June, May or June, to Jersey. He could not reconcile the fact that he was staying in one place, and he packed the whole car up. A few days later, he actually got into the car, and he drove away, and he said, "I'm going home." Instead of turning north to go to New Jersey, he turned south to go into Key West. After the car incident, I made an appointment with a neurologist. I realized he was starting to have Sundowners. At 5 o'clock every day, you turn into a werewolf. You don't know who the person is. Their whole personality changes, and they become scary, and you can't combat it.
For a lot of people, as the day goes on and they get more tired, they have less cues in terms of what day it is and what time it is. People sometimes, by the end of the day, around sundown, can get agitated.
It was like, I can't even imagine anyone going through it. But then I found out everyone goes through it. And over time, I guess the doctor was proactive and gave me a few drugs that would help, and they worked.
Behavioral symptoms are really very, very difficult to tolerate and to treat. The agitated, the behaviorally disturbed patient is much more challenging, and there aren't rewards, there aren't incentives for any of our healthcare system to want to take care of those individuals. We need those kinds of incentives and education and rewards because they're huge problems, huge problems.
Every neuropsychiatric symptom has a different course, and it's highly dependent on the individual. I've seen individuals who have a history of depression, and they get very depressed, sometimes early on in the course of Alzheimer's disease, and it can be very challenging to get them out of it. At that point, it becomes more difficult over time for someone to really engage in psychotherapy, so sometimes we have to really focus on medications. There are medications now that can help to enhance cognitive skills. modestly. At the same time, we know when you get people involved in meaningful activities, it can also help improve depression and other symptoms.
The most important thing is to see them. And by seeing them, you have to understand that they don't have a memory, but who is this person? What does he like to do? And that's how I live my life with him. And anyone can do it. That's the most beautiful thing.
It's okay. No, you don't worry about it. We got you. All right, we're going up.
My mother is 99 years old. She spent most of her life as an administrative assistant. She was a dynamite person, is a dynamite person. She's still there. She walked into a room, she would light it up. She was full of fun. As children, she would tease us relentlessly. She'd do things like walk through the airport and sing at the top of her voice, you know. We'd pretend not to know her, and she'd go, "Are you pretending you don't know me, who I am?" I thought that she was beginning to have signs of dementia, and I took her to see the doctor, and he says, "Let's start her on some depression meds," which we did because she was losing her sense of humor. She was miserable a lot of the time, but she stayed pretty cognizant right up until COVID. Then COVID hit, and we were locked down for 2 solid years. All she saw was me. And I noticed a decline right away after COVID. It was pretty rapid. I think one of the reasons Mom has been around as long as she has been was because we went immediately to Dr. Agronin when I noticed that she was more depressed than usual and upset. I started doing stuff with her to keep her active and alive.
We have effective treatments for that depression, anxiety, behavioral changes, apathy. Not always perfect, but we can improve them. We can get someone to a better place. It relieves some of that pain and suffering.
The reason I think she's so unhappy is that she's still cognizant of all the things she used to be able to do, but she still keeps going. That's what's so amazing.
Hi, Grandma.
Hello.
It's Mekia.
I believe I was about 5 or 6 years old when I performed on stage with my grandmother. And we did a little duet. For me, it felt like, oh, this is exactly what I'm supposed to be doing.
Christmas presents.
Well, Mekia, she sings, dances, and acts. And she started working mostly in TV. She got little parts here and there, and then finally she got on to The Rookie, and she's now a firm member with them.
My aunt has been pretty amazing with my grandmother. I can tell, though, that it takes a toll on the person that has to take care of someone full-time like that, a grown adult. She is seeing the deterioration of her own mother. And I don't know what that would feel like.
One thing that I have learned is that I have to change my way of doing things to accommodate her as she loses more and more of her cognitive skills. She has hallucinations some nights. She'll wake up and tell me that the doctor was there, and she saw the nurse coming in the house and things like that. She doesn't remember people she hasn't seen for a long time, but so far she remembers me.
You know, my aunt is retired. She used to love to volunteer at church, and she's a people person. She likes being around people. And, you retire, you want to be able to travel, you want to be able to do all those things. And unfortunately, she hasn't really been able to do that because my grandmother is there, and she is reliant on her. And so I think that in itself takes a toll. My aunt is also getting up there in age, and so to have to bend over constantly to, help bathe, or, it's all the things: help bathe, help use the restroom, help feed, help change clothes. That physically can take a toll on you.
Looking after her and caring for her is very hard because it's both emotionally and physically difficult. Emotionally, because you remember the person she was. And I've broken down in tears. I've run into my room in tears when I see her trying to feed herself, trying to do things, But unless I collapse, she's staying with me.
I will also say, make sure that you are checking on not only the person who has Alzheimer's, but you're checking on those around them, especially those who are caring for them. My aunt is really good, she's really strong, but I feel like whenever I can show her love and give her help, and the rest of the family can as well, it's important to do so.
It's your turn, Zuzu. Try and find support. That is very, very important. A support group. I'm very, very fortunate through the program I belong to. There are several people dealing with what I'm dealing with.
I appreciate everything you guys are doing. I get as much support as I need. Anytime I need something, Kris and Jess have it for me.
Just give yourself grace. There's going to be days that's hard, and then there's going to be days where you won't remember that someone has Alzheimer's or dementia because they're doing really well, and it's great. But just give yourself grace on everything that's going to happen.
We really want to take a very aggressive approach to identify and treat these symptoms because they really reduce quality of life both for the person and for the caregiver. It increases costs. It increases the risk of someone having to go into a nursing home.
So I want to give my mom as much as she gave me, which was everything. It was, she gave me life. I want to make sure that she's well taken care of and say thank you for that. So, it's, it kind of goes back to the whole, is it a job? No, it's a responsibility. It's my duty. This is what you do.